Good morning. Do I get a good morning back? Thank you so much. A good morning, a very warm welcome to all of you. With utmost pleasure and privilege, I welcome you all to this special campaign from Apollo Cancer Center, Hyderabad, Together for Her. And being a woman myself, I feel utterly proud to host this program that educates and empowers women in cancer well being. Before we delve into our program, let me once again welcome all our dignitaries, the press, and of course, our brigades. Now, talking about what is a Purple Clip Brigade. The campaign Together for Her, Be the Change, Be the Voice, Be the Change, Be the Voice is a unique kind of campaign that Apollo Cancer Center has initiated. That is to ensure that there's an empowerment to women to advocate for cancer today. Is it okay? Thank you. Right. Sorry, let me start from where we have stopped. What is a paperclip campaign or paperclip brigades? The campaign Together for Her and Be the Voice, Be the Change is a unique and a one of a kind initiative that Apollo Cancer Center has initiated that to empower women to advocate for cancer. Today, we stand in our commitment to spread awareness, offer support, and to inspire hope. And Purple Clip Initiative symbolizes a personal commitment to women's health, much like clipping for protection and prevention. That is just like saying clipping it in the bud. And propagating this awareness and this initiative to every woman in our lifestyle requires a force that was spearheaded by and readily willing and enthusiastic students who was identified from 20 different colleges in Hyderabad city. They were trained on various aspects of women's health, precisely on cancer, like encourage regular screenings and emphasize on importance of early detections and many more. And in addition, they were also educated how to disseminate this particular. I think there's an echo that's coming up. Right, right. So these students who were selected, 52 young spearheaded, were actually given training how to encourage people to do a regular screening and to emphasize the importance of early detection and more. And in addition, they have given the knowledge how to disseminate this knowledge to fellow women members in their livelihood, helping women to embark on this journey together, remembering that awareness is a first towards prevention and compassion is the cornerstone of support and helping every woman to clip it on time. Thus, India's first Purple Clip Brigade was formed. And I would request all of you to give a big round of applause to this 52 young women. Thank you to all of you. And every woman in here are champions of Purple Clip. And we take the oath of helping one another and who are leading the charge for change. Your engagement is vital in fostering a supportive environment where we can learn from one another and work towards a common goal that is being the voice and being the change. And with that, we will kickstart the program. We will start with a panel discussion on women's cancer awareness, followed by a Q&A session, and then lastly by the photo ops with Purple Clip Brigades and the dignitaries. And for the panel discussion, can I kindly request, formally let us welcome Dr. Sai Lakshmi Dayana, Consultant Surgical Gynec Oncologist, Apollo Cancer Center, Hyderabad. Welcome, ma'am. Thank you. Followed by Dr. Pratima Kanumuri, Consultant Surgical Breast Oncologist, Apollo Cancer Center, Hyderabad. Next, Ms. Swapna Saripalli, Head HR, Chubb Business Services, and Harvard alumnus. Dr. Christina Chongutu, IAS, Secretary to Government, Health, Medical and Family Welfare. Welcome, ma'am. Mr. Vijay Kumar, IPS, Additional Director General of Greyhounds and Octopus, Telangana Police. And of course, thank you so much, sir. And of course, we do have our doctor, P. Vijay Anand Reddy, the Director, Apollo Cancer Center, Hyderabad. And he will be the moderator for the panel discussion. Right, sir? I hand over the forum to you, sir. Thank you.
Thank you. A very good morning and a warm welcome to all of you. The hand that rocks the cradle rules the world. I repeat, the hand that rocks the cradle rules the world. Of course, these days, most of the men started rocking the cradle, but still, this statement holds good for the wonderful woman. I always feel that God's one of the wonderful creations are women. Every stage of woman's life is admirable and adorable. Right from sweet little child, a bubbly teenager, a loving wife, caring mother, and a blessing granny. Always, I feel proud to be associated with women groups, and I have no hesitation in saluting them. Hats off to you. Love, care, compassion, and selfless service are synonymous with womanhood. Mahatma once said, men cannot be equal to women in terms of selfless service. God has been partial to women in one more way. Most of the diseases, including cancer, are curable in women compared to all cancers in men. Not only that they are curable, but they show warning signs and symptoms much earlier in women compared to men cancers. So I'm sure God has showed this on women because we know and He knows that women are indispensable. So you deserve the best, and why you neglect yourself? Today we have gathered here to listen from the eminent personalities, achievers and opinion leaders, what a woman should do to take care of herself and her family and the society around them, together for her. It is indeed great pleasure to welcome you all the dignitaries here and the students and the press for this initiative from Apollo Cancer Institute. To start with, may I ask Dr. Sai, what do you think the reasons that these cancers have significantly increased in the recent past?
So, the basics of any human or animal life is eating, sleeping, and physical intimacy or sexual intercourse. And going back to the basic roots, the way people eat and the amount of quality sleep they are getting, and the increase in sexual activity or sexual promiscuity is probably one of the reasons we are seeing a lot of cancers in humans and especially in women. As a gynecologist, I'm more focusing on the cervical cancer too. And we're seeing a lot of youngsters participating in sexual activity, premarital sex, and that is leading to HPV infections. And these same people are not paying attention to the quality, quantity of food, either too much or too little, and too many distractions to get good quality sleep.
Madam Christina, if I may ask you from your angle, not from the medical side, why the incidence of cancer is increasing day by day? Of late, in the last decade, the from 6 lakh per year, it has gone up to 12 lakhs per year in our country.
I would say that definitely the impact of changing lifestyle has a big role to play. And as we are progressing, I mean, a lifestyle change has not necessarily been adapted to make us, more conscious about the better health choices that we have. And that is why I think one of the more important things when we talk about diseases which are non communicable like cancer, we give a large focus on the role of information, education, and communication. Now, especially in the case of cancer, awareness and early detection is critical. Whereas I think when we have got a large advancement in science technology, I mean the kind of health facilities that we have are much better as compared to, let us say, a few decades ago. But it is up to us to actually spread this message of awareness among the youth and among the upcoming generation, so that we are conscious about the risks that we face and that we can make a better use of the advancements in healthcare, so that we can be aware of what could be a problem that would face us in the years to come, and that we can detect it at a very early stage, and that we can learn to manage our health in a better and a more sustainable fashion.
Thank you, ma'am. If I may ask you, Dr. Pratima, what could be the most common causes that we can get intervened and do something to protect ourselves from developing cancer?
Just speak, Pratima. I think it.
Hello. Yeah. Like everybody has already talked about the lifestyle changes that we are noticing, cultural changes that have happened recently. Some of them are modifiable and some of them are not. It's more the really the few risks that we can actually modify is basically being eating healthy and really maintaining an ideal body weight and actually exercising regularly has really shown a lot of benefit in preventing cancer, as well as also avoiding recurrence or decreasing your chance of recurrence if you have already been diagnosed with cancer. So these things have been proven. Especially for breast cancer, alcohol consumption has really increases your risk of breast cancer. So that is a modifiable risk factor. Smoking also can increase it slightly, but we haven't seen as much as an association with breast cancer like we've seen with alcohol. Um, the other thing that we have really seen a strong association is early, the number of ovulatory exposures our body goes through, because every time there's hormonal changes with our monthly periods, our breasts get affected. So if we have early menarche, late menopause, also using hormonal replacement after menopause, which because of the symptoms that the women are experiencing, having children late, IVF treatments, and also decrease in the number of pregnancies that we are seeing, all of these also increase your risk of breast cancer. So a lot of times some of these things are not modifiable, because yes, there's a lot of change in our culture now, but it's important. Our goal right now is to really improve awareness and really spread the right kind of knowledge and an openness and confidence to actually deal with the problem and use the facilities that we have and have access to care to really find the cancer early and actually get treatment in a timely fashion.
Right, Dr. Pratima, you nicely put it as modifiable and not modifiable. So, what are the modifiable things that we can be doing something by ourselves which we can prevent our cancers? As WHO pointed out, we are not worried about the epidemic of virus. We are more worried about the epidemic of smoking and chewing tobacco. So, that is a bigger killer. If you look at the incidence of deaths that happen in our country or across the globe, the biggest killer compared to any other reason is smoking and chewing tobacco. So if I may ask you, Ms. Christina, what is that we can do to, we know that it's a poison, but we are selling it freely. We heard about COPTA and how far the government is going to help us in implementing this COPTA. Especially the young children are getting exposed, available of smoking, chewing and tobacco near their schools and colleges.
I think that it's very clear that public policy often supports the concerns of the public at large, and acts like COPTA have been introduced, giving a lot of room and leeway to the states to make their own amendments and additionalities based upon the concerns that we face in our respective states. And recently, in this regard, I think the state of Telangana has also, amended and enhanced the scope of COPTA by also addressing the menace of hookah parlors and hookah bars, which was also done in a few states like Maharashtra, Tamil Nadu, and Karnataka. So I think that this kind of support that we have in terms of regulation is definitely critical in ensuring that there is some watch and ward on this menace of non-communicable diseases. And apart from that, like we say, everything cannot be regulated. It also is very critical that the public is aware about what is a norm and what is a rule and what is doable and what is not. So when the legal provisions are created, it is meant for the public to understand and to make better use of these of provisions that are enacted, so that the vision of public policy is not just for the regulatory purview but also for a collective implementation. Now it's an individual choice whether one has to smoke or not to smoke, but there have been progressively a lot of decisions taken in government that we should protect the health of those who are not smoking, that there may be some taxes and there may be some surcharges levied on consumer goods that are found to have a detrimental effect on health. And these kind of things are meant to discourage the use of potentially harmful substances by the public. But overall, ultimately, we all know it's a consumer's market, and there has to be a lot of social consciousness and awareness. And in this regard, I'm very glad to know that, yes, the younger generations, we hardly find people who smoke. The incidence of people who smoke is definitely coming down as we see it. A lot of the youngsters are consciously making this choice. There have been a lot of IAC in theaters and in cigarette packets. There are these, rather grotesque and frightening images that are put. But ultimately, yes, the message has gone through to the youth. And I think we need to really stress on making our younger generation more aware of what are the harmful substances that are available, and which maybe we need to be very cautious about uh, controlling, and about ensuring that we do not partake of these harmful substances.
Well said, Ms. Christina. It's wonderful. It's ultimately boils down to social responsibility and self-discipline. So my question to you, Mr. Vijay Garu, pointing fingers at something which we can't do anything, talking about pollution, talking about pesticides all over, which actually are 2 to 3% cause reasons for developing cancer. There are far more self reasons that imbibed by ourselves, which are the reasons for developing cancer. What is your opinion on it?
As you rightly said, there are issues external which lead to rise in number of cases of cancer, and there is not much we can as individuals do about it. Governments of the day are doing their best. Societies are also chipping in as and when possible and to the extent possible. But there are a lot many things which we as individuals we can also do. I would like to break this into three components. A healthy or a happy mind or soul, a healthy or happy body, and then your immediate healthy environment. These three things are in your control, and I would little bit like to take away all of us to ancient, or not very ancient, but a traditional way of living, which was there in the Indian society. Uh, you know, the Indian philosophy, the so-called Hindu philosophy, also speaks of dharma, artha, kam, and moksha. But they say that all this should be in equal proportion. So while you make a living as per dharma, and you also enjoy that living. That is your calm. It's not only about sexual relationship; it's about all your desires. You fulfill all those in proportion by making money as per dharma, If you do that proportionally, you will attain nirvana. Nirvana, they say, is nothing else but being in a happy state. You don't have to go to other world to attain nirvana. So, uh, so this happy mind is a very, very important factor. It's not only for cancer, it's for overall well-being also, happy body as well, and our immediate environment, which we can only impact. For example, uh, 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 in last 20 or 25 years, there has been a 180-degree change in a way that earlier we used to go to market to buy something, or you go to kitchen to get something, or you go out, or you have to go shopping, you have to go out. Now everything comes to you. So your body does not need to be mobile at all. You can be lying in your bed from morning to evening and spend the night there as well, and everything will come to you. Now, also, if you realize, all of us suffer from this cell phone syndrome, that like we sit in the back of the vehicle while the vehicle is moving. It's impossible not to touch the cell phone, for me also, for in 5 minutes, just for the heck of it. I mean, there is nothing important, there will be no important messages to respond to or nothing, but cell phone to touch karna padega. So the mind is so overactive all the time, the body is so lethargic all the time, which actually should have been ulta. Your body should have been active like a farmer, and the mind should have been calm. So there has been a paradigm shift, which probably affects all of us, and probably affect the future generations more and more. So we have to have some kind of control on that, and to bring back to a normal. Also, our immediate environment, that is our house, our neighborhood, and these things is what is in our control. We can take care of that. Thank you.
Thank you, Vijay. So all in all, we should understand that it's a self-discipline, and it's our responsibility to take care of ourselves and spread that word in the society. And if you to make a simple statement, 85% of the cancers what we see are preventable. So these preventable cancers are our own reasons that we are developing more and more cancers. So we should be conscious about it, and we should take care of ourselves. Now, Ms. Swapna, so these days, as Ms. Christina was mentioning, the smoking has come down. Most often, when I visited the software companies and when I go there to give lectures, I've seen hundreds of girls standing outside the campus of the building and then smoking. So I've seen more girls smoking than the boys. So I'm sorry, correct me if I'm wrong, but several times I've
I
seen
would
that
chip
scene.
in and tell that suppose earlier 100 boys and 0 girls were smoking, the number would have probably come down to 40 boys or 30 boys plus 30 or 40 girls. So yes, it is true. It is happening. Probably it's a I mean, sorry, it's a probably time when girls are getting assertive, and this is a very wrong way of picking up the how to assert about things. Probably it is happening like that. Hopefully with time will come down the way it has come down in boys. This is really a very encouraging thing, that smoking has really come down among the boys who are in college.
So as a CEO, what measures that you would like to take to do this? And yeah.
So yeah, I beg to differ though. I don't. I see equal number, like he was saying, of men and women smoking, and that has come down a lot because you're not allowed to smoke in public areas now. So that has really reduced the a number of times people would go out for a smoke or do anything as such, right? So that is really reduced. But what is happening is, when you were talking about equality, is uh, we as girls have all, even for our daughters, right, we always tell you're equal to men. You have to study equally, you have to probably study better, you probably have to work harder to get ahead of men. And unfortunately the men are not told the same, right? And then what tends to happen is, you grow up very differently with very different ideologies, and then the clash happens. So that's what I've seen or I've noticed.
So besides that, I've seen most of these girls are more focused on their career, less focused on the marital life, and these kind of problems, and no exercise. So that's about what are you going to take do, whatever that you can do to get these people get more exercise, get into some kind of a sport, and then going for late marriages and not having children till 35, 36. All these are leading to
Yeah,
malignancies.
yeah.
So some kind of awareness you need to do, or repeated messages, or some kind of a workshop that you need to do among these girls who are working.
So I think what tends to happen is when we are asking our girls to be financially independent, your career clock and your biological clock are always at a clash, right? When I want to get married, or when it's the right time to get married, that's when I'm done with my college and I have to start initiating my career and work really hard. At least in the initial stages of your career, you're expected to work really hard. And when you're actually supposed to have children is when it starts accelerating, right? And it's a clash, it's a biological clash. Unfortunately, what tends to happen is uh, if you want to get ahead in career, you have to think about what is it or how can you balance, and that perhaps is leading to this. And I think a lot of corporates are doing a lot of things around this to see that we have returnship programs where we ask people to come back to work even after they've quit work post children. Right now there's a lot of sensitization that is happening across corporates. We are encouraging women to come back to work, we are encouraging them to have that work life balance, and probably that should ease out. So I think what we need to do is build that ecosystem at home and at office, right? You can't work as if you don't have a home to take care of, you can't take care of home as if you don't have a full time job. But that's what is expected of out of women, and unfortunately that increases your risk, your stress, and everything else. So,
So
yeah,
I remember my grandfather and my father telling me that everything has to be balanced. Everything has to happen at the right time and the right age.
yeah,
There's nothing should be stopped for something to be finished. So then you are going to lose your life. So for
yeah.
me, scientifically, physiologically, the girl should get married between 22 to 25, and the first delivery has to be before 30 years in
Yes.
every aspect, physically, mentally, psychologically, everything matters when they are having timely marriage and timely children, not just protecting. Please come on to the dais.
So I will just call her up onto the stage
Yeah,
too.
sure.
So we are being joined by Dr. Ananta Shankar Jayant, Indian classical dancer, choreographer, and a Padma Shri awardee. Welcome, ma'am.
So right time, right things to happen. So at the age of before the age of 25, these girls should get married, and before the age of 30, they should have the first child. To have in every aspect the feeling of well-being, good health, and preventing from major 5 illnesses. That is the right time to think. So I would again say, reinstate that the girls should not just focus on career; they should take care of themselves as well as their family to have a good, healthy life.
And the initial stages, if you do that, then you have the rest of your life to take care of your career
Absolutely,
as well. Yeah.
absolutely. So, a question to you,
And
Ms. Ananda Shankar.
sorry, I just want to reiterate one thing. I know it's a lot of things have been said about what women should do. I think a part of this happening is also men participating in the process. Unfortunately, we are not living in a time that was like how it was when our grandparents were there. There's a lot of pressures of living an urban life. There's a lot of pressures of financial pressures to survive, and kids are a very expensive expensive commitment to make, both, and also bringing up these kids in a very balanced way. Are we going to be able to do it? Because sometimes bringing up a kid is just not giving birth to one, actually creating an environment that's really healthy. And for this, the home environment really matters, and there's a partnership that has to happen. And it's the community has to
Fatima, we are
support it.
diverting our discussion to
No,
some
but
other
I
thing.
want to make that
So,
very clear.
you understand. So, the question to you, and it's as a mother. So, what can a mother do to cultivate good habits in children and to take care of their spouse? I'm not saying that husband should not take care of a wife, but as a responsible woman, to cultivate good habits among children right from childhood. If they start doing it, they'll continue to grow in the same fashions.
Thank you, Dr. Reddy. At the outset, deep apologies for being late. I got caught in a crazy traffic. I think there's a lot of traffic on that side of the city, so apologies for that. Yes, so what is it that a family can do? What is it a mother can do? What is it that parents can do to give a rounded growth to the child? Is that the question? The holistic growth.
Yes.
So I come from the space that I have grown up in. I come from a middle class family, who very early my parents chose to provide me a training in the classical arts, and I think that has helped me tran- uh, transit through cancer. I've had a tryst with cancer, breast cancer. And you will ask me, how are these two connected? How is a training in Bharatanatyam helped me deal with breast cancer? Well, the simple answer to that is, while the clamor and clutter of cancer is constantly around us, and I'm sure you as doctors know that it comes with its own melodrama. Cancer comes with its own melodrama because it has treatment, it has a downside, physical, mental, psychological downside of the treatment itself, all the side effects, and to deal through it, to transit through it, to be able to go over it. What will help us is something else. While doctors and medicine do what they have to do, and they do a great job, what you will have to do as individuals and as family members is to be able to tap into something different, to be able to ride out this process of treatment, which has its own side effects. So not taking away from the treatment or from what it will give to you, which is necessary. What you as a family can do is to train your child not to be ready to receive cancer. We don't want cancer to come to anybody, but but we don't know that. It's not, we don't know whether it will come to you or not. So that's a big if. However, if from childhood, if you're able to train the child in something which could be, I call it a core strength. You're all core competent nurses, doctors, engineers, bureaucrats. But what we are also forgetting in our academic training is we don't give a core strength to the child. And that core strength, I believe, comes from one's talent, from one's unique talent, which, if the parent is able to identify and nourish and cherish and train from early days, that will at some point of time, you may or may not make it a career, at some point of time, in the event that a challenge comes to you, and if the challenge is cancer, this will help you ride it out. To me, that has been my learning, and that is what I would advise young parents, because today's young parents are so focused on chaduvu, 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 which is good, But after that, there's something else that me space. If that me space can be trained from childhood, I think it'll help in the transition, not just for in face of a challenge, but just in life itself. Makes you more rounded.
Wonderful. So besides that, if I may add, if you cultivate the habit of taking green salad, cultivate the habit of taking fruits, all kinds of vegetables which are naturally available, and cultivate the habit of taking vegetarian, more of vegetarian diet and less of non-vegetarian, they would continue to do that in their lifetime. They would love to take salad, and you cultivate the habit of doing some kind of exercise, getting into some form of sport right from childhood, the child would continue to do that in their lifetime. So this is very important for the parents to imbibe that habits right from childhood, so that by growing they would continue to do that. So finally, screening and awareness is very, very important. So in that regard, what government can take some initiatives to help to do the screening in our state of Telangana?
Thank you. Yes, it's very true that screening is critical, and in this regard, consciously focusing upon women, the government of Telangana has started this. It's called Arogya Mahila Clinic, and this is not just at a few select destinations. This is done across our state of Telangana, and this is launched during the International Women's Day in 2023. So it has recognized that yes, women, when they have to come together with the men, and we have a very general kind of a checkup happening, then obviously we tend to lose track of what could be the specialized needs of women. And we are aware that very high case incidences of breast cancer, then cervical cancers, and then you are having ovarian cancers, and these, they require this presence of a women gynecologist. You require a different set of people who are available to make the women comfortable to get themselves checked up even in rural areas. So this has been a very novel initiative, and I think it's a very good one that has started all over Telangana, and it provides 8 packages of healthcare. And I think this is really percolated down to the grassroots level. It's not just an urban phenomenon. And the total number of cases that are coming to these Mahila clinics are quite commendable now. And it also covers, strangely enough, when this was being conceptualized, a lot of the districts gave their feedback as to what were the issues that women would raise when they came to these Mahila clinics. And these Mahila clinics, apart from raising the issues of, gynecological checkups and other such issues, they also talked about, weight management and the role of, menopausal, hormonal fluctuations, which, obviously was also, weighing heavily on the mind of women in rural areas. So even how to cope and how to deal with menopausal symptoms. That was also one of the issues that they deal with. And 372 primary health centers in our state run these Arogya Mahila clinics. And so far, I think we have had around 15 lakh screenings that were done, and this is a huge number, and this happens on a regular basis. And now we're trying to scale it up so that more number of women can be covered in these Arogya Mahila clinics. And the diagnostic symptoms is, I think, oral cancers, 19 of them have been detected so far, breast cancers 94, and cervical cancers 124, which brings me to a lot. Very frequently we are asked about the introduction of HPV vaccines for adolescent girls, and also as an augmentation for this. But as we are all aware, or as most of the medical professionals here will be aware, the HPV cancer is as of now not widely available. It is still very highly priced, and we are waiting for the government of India to announce something in the respect of including it in the universal immunization schedule. Recently, during the parliament session, the honorable finance minister had indicated that they would encourage or they would promote the use of HPV, but to what regard and to what degree, we'd have to see. And I think there are two factors linked to this. One is obviously the willingness and the awareness among the demographic that we're looking at, adults and girls. And the second would be the availability of the vaccine at affordable prices to make it accessible. So I think this is something that we need to also have a dialogue about, because healthcare that is not affordable is not accessible. And when we're looking at accessibility, I think this is one important thing that the governments could work with the private sector on.
If I may add just a point, that the first thing, I think, if you haven't discussed it earlier, if I might have missed it, it's just that I think most of us as women put ourselves on the back burner, putting the family in front, ahead, putting children ahead. That if that mindset slowly and steadily through these training programs, that I think will be our first barrier. If we can break that, especially in the rural areas, I think we face that heavily, and I'm sure doctors are aware of it. That ఇప్పుడు నాకెందుకులే, let the child, పిల్లలు చూసుకుందాము, పిల్లలు చదివిన తర్వాత మనం మా హెల్త్ చూసుకుందాము. That mindset is there. I think somewhere that if that changes, I think things will change.
Thank you. Thank you very much. And to conclude, yeah, please, Vijay.
Can I ask one question?
Sure. To the moderator.
Sorry. So, a lot of information is floating around in social media about the virtues of going on fasting.
Yeah.
And they say that it induces some kind of autophagy, it kills your cancer cells and all. Then all religions prescribe some kind of fasting. You have in Hinduism, you have in Islam, you have in Christianity, the major religions. What is the concrete thing out of it, fasting, and impact of it?
Scientifically, there's nothing proven as of now. See, every cell needs glucose. So the cancer, because it divides faster than the normal cell, it is assumed that the cancer cell will develop or get instigated by taking more glucose. So fasting definitely reduces the CHO levels in the body. So that is a hypothesis that's been created, and this floated across all WhatsApp groups, that whoever takes, even our patients, they come to us, they're not eating at all, and they say, if I eat ice cream, cancer will develop. So you need some kind of a glucose anyway. The brain will function only with glucose, nothing else. Fat and proteins don't reach the head. So brain requires CHO. So it's not proven, but it makes sense in discussing. But we need a balanced diet. We need CHO, protein as well as fat. Less of fat, less of glucose, and more of proteins. That is the bottom line. So to conclude, we all agree that women's health is very, very important for her. It's not in the backdrop, but it should be in the forefront, because she is the anchor of the family, and unless she is there, nobody else is there in the family. So it's very, very important for herself, family, society, nation, and universe. So we all understand the importance of health, and health is wealth. And prevention is better than cure. For prevention, what we need to do, we discussed all through. So good diet, balanced diet, as I said, less of carbohydrates, don't become obese. Obesity is one of the important factors to develop cancers. So good exercise, at least any sport is very good for you. Exercise is not strolling around and walking around for youngsters like you. You should get into any kind of sport. Sport is the best medicine and the best meditation. So besides that, regular prevention, regular screening is very important for people who are above the age of 35. Compared to other parts of the world, our generation at 35, people are getting cancer. So other countries in the Western European countries, they said 40 and above or 45 and above. But for us, 35 should be the limit to start screening. Screening is something that you send your vehicle for servicing at 5,000 kilometers. Why can't you send your body for servicing? So it's as simple as that. You spend 2,000 rupees for servicing for your vehicle without any problems. You're sending it to servicing center. So send your body also once in a year to diagnose your any without symptoms. You're diagnosing a disease. Obviously means it is an early disease. So you will get away by simple treatment, easy treatment, and cure is guaranteed. So screening is very, very important. Please do spend some money for screening. And whenever a hospital comes out with an ad of screening, people say it is commercial. Not true. We are all subsidized perennially in Apollo Cancer Hospital. Even this initiative we are doing for 1,500 rupees, which is 70% subsidized for cancer screening for any woman walking perennially at any point of time. So mammogram, pap smear, ultrasound, everything is done. So please get aware of it, and please send your moms and dads for regular screening. So don't be scared of cancer. As Vijay was chatting with me, he was telling me people are getting scared to go for diagnosis because they are suspecting that they are going to be diagnosed of cancer. That is unfortunate. So if you have any symptoms, don't shy away from going to the hospital. Get investigations done. Every symptom does not mean that you got cancer. You may have cancer. So when you diagnose cancer at an early stage, you're going to get cured. So as we just be alert, that's all we wanted. So, as we honor the strength and resilience of women today, let us remember that self care is not selfish, it is essential. So, let us prioritize our health, both physical, mental, knowing that by nurturing ourselves, we empower ourselves and pave the way for a brighter, healthier future for all of us. On this Women's Day, I wish and urge all the women to, to please take care of your health and stay healthy for yourself, as for the family, and for the nation. Wish you all a very happy International Month. March is taken as International Women's Month, and enjoy your day. Thank you very much for gathering here. God bless you all.
Thank you so much, sir, for those insights and thoughts that we all can ponder on. And unanimously, everyone just talked about the early detections and early screening. And if that is done, we can all clip it on time. And the government actually helping in every aspect uphold it. Thank you to all of you. We would like to have another photo opportunity right now. And I would request all the dignitaries on the dais to help yourself onto the chair that has been arranged on the front, please. Along with them, can I have all the 52 brigades, the champions, Purple Clip champions, to come forward? The girls, please help yourself onto the stage, onto the top of them, behind the dignitaries, please. I want this to settle down. Right. Do we have all of them on the stage ready for a photo? Along with them, can we also be joined by Mr. Richard, the VP? Please, sir. With this, we emphasize the purple clip, the brigades, the champions that is going to empower every woman.
Come on, brigade, cheer up. Smiles, please.
These brigades will be helping every woman in our society and community to help them for screening and early detection. And it's good to call them as the Purple Clip Brigades and the Purple Clip Champions. A heartfelt thank you to all the champions here. Thank you for being a part of it. And thank you to all the dignitaries.